Good morning. Good morning and welcome.
Mhm.
I am Brenda DeBerry, co-president of the Ohio Kinship Care Coalition. We welcome you this morning to today's presentation, which is Ohio Women, Infants, and Children, the WIC program. Our presenter today will be providing you with some helpful information as kinship caregivers moving forward. Before we begin the presentation, I'd like to ask that all of the caregivers put their name in an email in the chat to be eligible to be selected for a $50 gift certificate. The name of the person winning the gift certificate will be called at the end of the meeting. Please note on your calendars that our next meeting will be April the 21st, and our presentation will be on early interventions programs. If you're interested in receiving a certificate of participation, one will be provided for you. We ask that you put your name to Barbara Turpin in the email if you would like a certificate. At this time, it's my pleasure to introduce our guest speaker, which is Bree Haviland. She is a registered dietitian and certified lactation counselor. She has been with the Ohio Department of Health for 13 years with various roles focused on nutrition and education to include breastfeeding support. She is currently the assistant director of the Ohio Infants and Women, Ohio Women, Infants and Children program. Please welcome Miss Bree. Thank you. Miss Bree?
Hi, good morning, everyone. Can hear me okay? All right. Thank you for having me and have the pleasure to talk about the WIC program for a little bit today. So our official name is the Special Supplemental Nutrition Program for Women, Infants, and Children, but it's a lot more easily known as WIC. We are a preventive nutrition program, and we focus on providing nutrition education and counseling, breastfeeding education and support, supplemental nutritious foods, and referral services to other health and human service programs. The population that we serve include pregnant women, postpartum women, so they're eligible for 6 months after the baby's birth, but they're also eligible up to 12 months after the baby's birth if they are exclusively breastfeeding. And they're also eligible if their child's just under 6 months. So 1 year postpartum if they're exclusively breastfeeding, 6 months if they're not. For infants, we call them from birth up until they turn a year, and then children are from 1 to 5. So they are eligible through the month that they turn 5 years old. What the WIC program looks like here in Ohio. So we have 75 local WIC projects, and there are clinics in all 88 counties. Some counties may only have 1 clinic, and then some of the larger counties have multiple clinics, but we are representative in every county across the state. We serve on average 180,000 participants each month, and here you can kind of see the breakdown, around 40-some thousand women, 43,000 infants, and just about 94,000 children. Our numbers kind of fluctuate month to month, but we're kind of right around that mark here. If you see our last numbers for February, really close to what our average was for last fiscal year. And then the funding that we receive comes from the federal government, and that comes from the United States Department of Agriculture to the Ohio Department of Health. We keep some of our funds for our administrative purposes here and also to cover the food benefits, but a lot of our money goes out to those 75 funded local projects so that they can actually implement the program in their counties. So we do not provide direct services here at the state level. That's all done at the local level, but we're here to kind of administer and oversee the program. What the program looks like here at our state level is we have our administration and policy. So that's our WIC director and my position as the assistant WIC director. We have an application and data management side. So they handle all the behind the scenes pieces. It's a very complex program when you're looking at providing benefits to the participants, but what good are the benefits if you can't use them at the store? So we have an entire vending unit that handles the authorized vendors across the state. Our nutrition administrative services consist of our registered dietitians, and many of them are breastfeeding experts. And so they're the consultants that actually work with the funded 75 programs across the state just to make sure that they're implementing the program according to our federal regulations, and also providing technical assistance if needed. Our program analysis provides the background for our funding, our caseload, a lot of the data assessment piece to it. And then we're fortunate to have a farmers market nutrition program operated by our state WIC program. So even though it has different funding than WIC, we are able to include it here in our program. And we work closely alongside the Department of Aging for the senior farmers market program. And then that, also has our program integrity and program compliance. So just making sure our vendors, our participants, everybody is following the federal regulations that are set forth. From the local WIC program side of things, so again, the state provides the funding to the locals to administer the program. So they see the participants through in-person visits. And so they're looking at making sure they're coming in, they have all the documentation, everything that they need. They're going through one of the big pieces that differentiates WIC from SNAP is that we are a nutrition education program. So they're required to come, participants are required to come to the local WIC clinics. We do a growth assessment. We assess for hemoglobin or for their iron status. And then we also issue supplemental healthy foods. But every time that we have an encounter with a participant, we focus on providing nutrition education. So what makes us more the standout nutrition education program. And then also we provide a lot of breastfeeding education and support. So we have trained lactation professionals at all of our sites to be able to work with our participants and help them meet their breastfeeding goals. As far as eligibility, there are 6 different pieces that will qualify somebody for the program. So the first one is identification. So we need to see that, our participants are who they say they are. So we collect that information at their appointment. Again, they have to fit into the women, infant, or children. So again, pregnant, postpartum, or a breastfeeding woman, an infant or child up until age 5. Participants must live in the state of Ohio. They don't necessarily have to go to the clinic in the county they reside. They can go to any clinic, their choice. So a lot of times if somebody lives on the border of one county, it might be closer to go to the clinic in the neighboring county, and that's totally fine. We also have to qualify our participants for a medical or nutrition risk, and that's determined by the local WIC health professional, which is typically registered dietitians or nurses or dietetic technicians. So we go through kind of a health history. We ask a lot of questions. We talk about the eating habits and the diet, and we are most likely able to find a medical or nutritional reason to qualify our participants for the program. Additionally, we have a physical presence requirement. So that means our participants must be present at the local WIC clinic for their appointment. Through COVID, things changed a little bit. There were some adjustments to that, but we want to see our participants back in person. It's really helpful for our staff to assess the growth and have physical eyes on the children especially. But there are a few exceptions where they may not be able to come, and that includes if they've already had some heights and weights or their hemoglobin assessed by a healthcare provider within 60 to 90 days, we're able to use those measurements. We can do that in lieu of them coming in, but we would prefer if they still come in and we'll just use those measurements and not take them on our own. And then lastly, the income piece. So everyone participating in the program must be within 185% of the federal poverty guidelines. So that's looking at a family of 4 grossing up to $57,720 annually. One of the nice things about WIC is that it's an adjunctive eligibility program, so that if somebody is receiving Medicaid, SNAP, and/or TANF, they automatically qualify for the WIC program, given that they meet our other eligibility requirements. So somebody may be over income, but as long as they're participating in Medicaid, SNAP, or TANF, then we're able to qualify them for the WIC program. Kind of specifically to kinship care, adjunctive eligibility, that's a mouthful, may be beneficial in this case, because again, if they're already receiving, a child's already receiving SNAP, Medicaid, or TANF, then they can automatically receive WIC benefits. But if they're not enrolled in either of those, the income is determined based on the household size where the child is living. So then that piece of income comes into play. It gets a little bit tricky and complicated as far as the local WIC clinic, as far as who can bring the child in and the required paperwork needed. Excuse me, sometimes if there is no legal paperwork, then it's really consulting with the local WIC clinic and deciding what is necessary for the kinship care provider to bring with the child to the appointment. So for the sake of this, the recommendation is really if you have a child you're interested in enrolling in WIC, to contact the local WIC clinic for the guidance, and then they can help you determine what paperwork and what's needed to start the appointment process. But so many different situations, and we don't want to get into all that today. So the WIC program has been around for 50 years. We celebrated that the beginning of last year, our 50th year. It's a bipartisan funded program, so it comes through Congress, and it's been around for 50 years. So I think that says a lot of the program itself. But some of the documented outcomes of the participants from the WIC include adequate prenatal care, healthier birth outcomes, increased immunization rates, enriched health care, better dental health, decreased infant mortality rates, increased rate of breastfeeding, reduced smoking, healthier food choices, and a lower risk of child abuse and neglect. And so the studies continue to show the benefits of the WIC program. So what a WIC appointment looks like, initially, if somebody's signing up for WIC, they come into the appointment, they provide the necessary paperwork, they're physically there so we can take their measurements. We go through a health history form. We ask a lot of questions specific to nutrition, but also, as I mentioned, we provide referrals. And so we're looking to see if they're living in a safe space, if they feel they have access to adequate food, if they've seen a dentist, if they're up to date on their immunizations, smoking status, drinking status. So you name it, we're kind of getting like a full picture of the appointment. That way we can help link to necessary other providers if we determine that's something that's needed. So they come in, fill out the paperwork. We're able to go through, we work to set a nutrition goal that they want to work on, excuse me, for the next 3 months, and then we issue the food benefits. So benefits are issued for 3 months at a time. And of course, they're getting nutrition education too. But the benefits are issued for 3 months at a time, and the benefits can only be used for the month in which they're issued. So there's no rollover or carryover of benefits. Anything that's not used is left unused and unable to be used in the future. And then, yes.
Oh, I'm sorry. There was a issue in the chat. I wanted to make sure we covered it. Ms. Wilmer said that we are here for, excuse me, we're here for kinship, most importantly. You passed over our part. Ms. Wilmer, are there specifics that right now Bree hasn't covered, or as she goes on, they will apply to kinship caregivers? I think, Bree, is that right?
Absolutely. It's just the point I was trying to make, and I apologize that didn't come across very clearly. It's just starting the appointment and the necessary paperwork. I can't sit here and say this is what you need as an umbrella statement for everybody. But yes, if you are a kinship provider, you are able to get the child on the WIC program if they meet the eligibility requirements. Does that help clarify? I'm sorry, I can't see the chat.
Is that answering your question, Ms. Wilmer? She said yes, it does. Thank you.
Thank you. Okay, so back to the overview of the WIC appointment. So we're seeing that initial appointment, nutrition education, 3 months of benefits. They come in for what we call a mid-certification, and that's where we're providing additional nutrition education and giving 3 more months of benefits. That takes us to the health assessment appointment, which is kind of a modified version of that very first appointment where we take some measurements. We check to see if anything major has changed. If not, 3 more months of benefits and nutrition education. And as you can see, it kind of goes through that cycle. So we kind of have a touch point every 3 months. The children aren't always there for those mid-certification appointments, which is okay, unless we really need to see them for a follow-up. But as you get the point here, the benefits are able to be issued at 3 months at a time. One of the things here in Ohio is that our benefits have to be issued on site. We cannot issue benefits remotely like SNAP. So if you're familiar with SNAP, the benefits can be loaded to the card anywhere at any time. That's not how it's operating in WIC, although we're moving to a model that will allow us to do that. As far as the benefits that WIC provides, so we do provide quantity and specific amounts, which also differentiates us from SNAP, whereas SNAP can give a dollar amount and then anything within the program requirements can be repurchased. That's not how that works in WIC. So we provide milk, yogurt, cheese, eggs, a variety of breakfast cereals, juice, canned fish, a voucher for fresh, frozen, or canned fruits and vegetables, peanut butter, canned and dried beans, whole grains, infant cereal, infant formula, and commercially prepared infant fruits and vegetables and meats. We also have a formulary of specialty formulas for infants and children, women too, that can come with a doctor's prescription. So a lot of times with those formulas, they can be very pricey. I mean, they're pricey without needing a specialty formula, but some of those specialty formulas are very pricey. So we're able to work with healthcare providers and make sure that we can provide those for child and infant needs. So as I mentioned, it's prescriptive amounts. So we do tailor the package, but there is a maximum allowance that we can provide, and that's listed in our federal regulations. So it's not up to us to determine how much, but for example, we can give up to 4 gallons of milk, up to 1 dozen eggs. Or if somebody says we don't eat eggs, we don't like them, we can say, okay, then we don't have to issue the eggs. So we do try to offer some variety. There's for juice, you can get frozen or bottled juice. Let's see, for the iron source with the peanut butter, it can be a combination of peanut butter or beans, or just peanut butter or just beans. So there is some tailoring involved. And then within the next year, we'll be changing our food package a little bit to open up the milk to include plant-based options and some other items that are more culturally appropriate for the populations that we serve. So looking forward to those food changes. The last major food change happened in 2008. So as you can see, it's been a while since we've been able to change anything.
So I notice on the list of commodities that are provided, there's commercially prepared infant fruits, vegetables, and meats, but there's no provision for meats for the older children. Are they, is it looking at some of the other proteins that are taking the place of the meat?
Correct.
Okay.
So yes, it's the peanut butter, the beans, primarily as the protein source, the eggs, but also right now the canned fish is only available for our breastfeeding women. And so our new food package will open that up so that the children can receive it too.
And the purchase of these, is it at the commercial grocery stores, or are there specific food sites for them?
Yes, there are authorized WIC vendors. We have around 1,200 vendors across the state. That includes our big box stores like Kroger, Meijer, Walmart, Giant Eagle, but also small mom and pop shops too. So to be a vendor, you have to also accept SNAP. So that's kind of the first requirement. And then there is an application process, excuse me, for us to identify our vendors. But there are some requirements to being a vendor, such as minimum stocking requirements and passing some compliance and monitoring visits and inventory audits. So we're fortunate that we have a wide variety of vendors across the state.
So do they get some type of a card, like a SNAP card to purchase these?
Yep.
Okay.
So it looks just like a credit card. It has our logo here at the bottom where it says Ohio Department of Health WIC. They have a PIN number. And so at the store, you purchase the items, and we have a list of everything that's included. It's available electronically, or we can print it out and give it to them, but we also have an app that has what foods, because there are specific brands or sizes that are restrictive, but basically just picking out the foods that you want, and then when you go to pay, you swipe the card, or you enter the chip rather, and enter your PIN, and then those amounts come off the card automatically.
Okay, all right. Well, thank you.
And then I mentioned there is the cash value benefit for fruits and vegetables. And so you can see the current values. Those actually went up during COVID, and we're fortunate that they've been approved to stay. For example, it used to be $9 a month for children, and now it's up to $26. So we're fortunate to see those strides in the amounts, but those can be used to purchase any fresh, frozen, or canned fruits and vegetables. They are a little bit restrictive. For example, if buying like a frozen vegetable, it can't be in like a cheese sauce or mixed with anything else. But for the most part, it's a very popular benefit. And I think that's one of the reasons we see a lot of people continue to use WIC benefits, because if you can see, if you have multiple children, that's a pretty decent amount to help towards the grocery bill each month. So as I mentioned, the benefits are issued to the WIC nutrition card, which just looks just like a credit card, specific to the participant's needs. So as I was mentioning, we tailor those benefits to each participant, but we try to provide them the maximum amount. The benefits are intended to be used for that participant, not for other members of the family, but as you can tell, it's probably difficult to ensure only that child drinks 64 ounces of juice. But that is the intent. And as mentioned, we can use those. I think our number is actually closer to 1,200 authorized vendors across the store. And then there's restrictive to purchasing only the items in the quantities that are allowable for WIC. And that's something that our team here at the state does, is making sure that the items meet the federal guidelines. So that could include sugar content, it can include sodium content, so different restrictions. And then we need to look at the items that are submitted to us from the manufacturers to determine if they meet the federal guidelines, so that we can include them. And then we house everything in a UPC database. And then once we're able to kind of put that together, that's how the store knows then if the item is WIC eligible or not. So those communicate. And so someone might pick up the wrong size cereal and say, well, I know Cheerios are WIC approved, but it could be that they just have the wrong size container of the Cheerios. The WIC Shopper app, this is a free downloadable app that's designed to make the WIC shopping easier. It's a very popular tool, and it has a lot of great features. So one of them, you'll see that button that says WIC allowable foods. So that'll actually pull up our list of all the foods that are allowable, and it'll even say maybe some that are not allowable too. There's a scan the barcode item, so you could be shopping at the store and say, like, I wonder if this is WIC eligible. Pick up the item, scan the barcode, and it will tell you yes or no if it's WIC eligible. So that's another way to help with the shopping experience, because it can be a little bit overwhelming when first getting used to it. There is the benefits tab where they can open it up and see how many gallons of milk or how many dollars of fruits and vegetable voucher are left for that month. So it's a good tool. Otherwise, the receipt is going to have that, and not everyone always keeps track of their receipts if you're like me. But also we have recipes that utilize the authorized WIC foods. The CDC milestone tracker is a great tool, and some resources from Cooking Matters. So overall, it's a great app that's free for our participants, and we encourage usage of it. As I mentioned, WIC is big on breastfeeding education and support, and that's included into the education of all our pregnant and postpartum WIC participants. And we have our breastfeeding staff on hand at all of our local clinics, up to our international board certified lactation consultant, all the way down to our breastfeeding peers. And our breastfeeding peers are women who have participated in the WIC program, but also have breastfeeding experience. So they're a great resource to help our moms. We can issue breast pumps for people that are returning to work or needing to use a pump, but we also work with our families to get pumps through Medicaid if they're eligible, or through their private insurance. One of the great resources we have across the state is a 24/7 breastfeeding hotline that's funded by the Ohio Department of Health and operated by the Appalachian Breastfeeding Network. And so they provide free 24/7 lactation support to all callers across the state. They're also able to refer to mental health specialists, and other local lactation referrals can be provided. So it's a great resource that we're able to use tangentially with the WIC program. I talked a little bit about the Farmers Market Nutrition Program. So the goal is to provide nutritious, locally grown fresh fruits, vegetables, and herbs from the farmers markets or roadside stands to our WIC participants. Not only is this good for our WIC participants, but as you can imagine, it helps our local farmers. So the funding also comes from the USDA, the United States Department of Agriculture, but the state has to put in a match. And so that's where I mentioned our partnership with the Ohio Department of Aging, Senior Farmers Market Program. And then also we have some WIC funds that we use to put in for that. So what the Farmers Market Nutrition Program currently looks like is a family can get $30 per participant. I think it's usually up to 2 participants per family due to the demand and the limited number of coupons. But they get 6 $5 coupons, and they're redeemable at any participating farmer market or roadside stand. And our season goes from June 1st until October 31st. Currently, we have 70 counties participating, so not quite statewide, but we seem to add 1 or 2 maybe each year, so we're kind of getting there. For fiscal year 24, which operates from October 1 until September 30th, we had over 108,000 coupons redeemed, and that put over $540,000 into the hands of our Ohio farmers. So it's a great program to support our farmers. Our local WIC projects don't receive any extra money to implement this. They do it because they love it and they believe in the program. And so they are actually the key to our program's success. Ohio has been recognized as one of the states with the highest redemption rates just because it's been so successful. We do have to contract with farmers and market masters, so that can be a little bit tedious to get set up. But once we can get everybody on board, we can make sure that they're paid appropriately in a timely manner. More on the farmers market program here, but basically the farmers can accept the coupons from the participants, and then they send them in to the state WIC office, and then we go through the coupons and we submit our payment to them. So a lot of manual processing on our end right now, but again, something we're looking to modernize in the future. But we try to keep it as simple and easy for our farmers as we can. Looking at applying for WIC, we do have an online referral form that can be filled out, and that gets sent to the local county near the zip code provided. And then the local county office will contact and offer to set up an appointment and get started. The eligibility screening tool is also a good tool if you're unsure if somebody's eligible for the program. You can answer a few questions there. It'll show you if they're eligible or not before you go into the office and start going through the process. A couple of different ways to find a local WIC office. You can Google it. We have a website, even texting capabilities at this point. But again, there will be a clinic in every county across the state. I just linked some WIC resources, more about the program, more about the outcomes. And then the National WIC Association is a partner that we rely on. That's kind of our advocacy arm for all WIC programs across the nation. Here's my contact information. So I know that was a lot in this WIC, what I like to call WIC 101, but I'm happy to answer any questions.
Bree, will you be able to make your PowerPoint available to us to put out on our OGKC website
Yes, sure.
as a resource? Okay, great. Thank you. Anybody have any questions, or is anybody that's on the call or the presentation, have you used WIC or taken advantage of the WIC program? Well, good. This hopefully will give information to the caregivers about how they can, if they have children that are within the age range of the WIC program. It seems to me it's a win-win situation, including, if you're eligible for SNAP, then, this is just in addition to that, which is very helpful. We have okay, let me see. Laverne Dotson, who is here in Columbus, she used it with her, I believe it's her grandson, when he was under 5. How did you feel about it, Laverne? How was it useful to you? Do you want to say? Maybe not.
I had
Okay,
to
well,
pause. This is Billy Wilmer speaking. How are you?
good.
Okay. I had to pause during the presentation. In fact, and I was speaking with my daughter, whose son I have custody of. Now, he's not eligible for WIC, but the baby girl who spends a lot of time here at my home would be eligible. I don't have custody of her. Would I be able to get WIC for her in spite of what it is that mom is doing?
Yeah, I would definitely say that's one of the situations where I said call the local WIC office and they can guide you through the process as far
Even
as
though I
who
don't
could.
have custody.
That's where it gets a little bit tricky. It might be that whoever has custody has to, but that's
But
why I encourage you to call and kind of explain it to them and they can help guide you. Or, one of the things that we can allow is an authorized representative. So if whoever does have custody would be okay with you bringing the child in, then they can fill out
yeah,
a form and then you can take the child to the appointment. So
okay.
there's a lot of different scenarios that can work, and we want to make it available, of course, if she's eligible.
Wonderful. Thank you.
And Laverne does say that it was helpful with formula, which I'm sure, because I think formula is extremely expensive. And
Absolutely.
so for this to provide that support, if it was just for the formula, I think it would be beneficial. Another person has commented, Sandy Bryant, who is in Dayton. It was always hard to tell what was needed for a kinship caregiver when they first got the child.
Yes, I can attest to that. It's not as black and white as we would like it to be.
So that's where contacting the offices that you have put down here is important, to explain situations, just not assume that, you're not going to be eligible, or possibly a parent may, the parent, and encourage them to apply, because it's, you don't want to make an assumption that you're not eligible, and then you could be, and it could be very helpful.
Absolutely. Or even if the child is receiving WIC, but if you're not seeing any of the food benefits and the child's in your care, that's another thing, another issue in of itself too, but it's always best to ask.
Right. And there's another comment that was made about court ordered custody, or, legal custody, where the family actually has custodial papers. a lot of our caregivers don't have formal custody. It's an informal situation. So is that something that they could speak with the offices about how you can verify that you do have this child full time, but not through legal custody?
Right, yes.
Okay, so I think the bottom line is if anybody is feeling that they're in a situation where this could help, I would reach out to make the contacts and just find out for sure and officially that you're not eligible. I think
Absolutely.
that's the important information that has been presented.
Absolutely.
Anybody else have any questions or comments?
I see
Agree?
Michelle has her hand up.
Hi, this is Michelle at Knowlton, and I have a quick question, and I do apologize if you answered this earlier, but why is there only 70 counties involved with the farmers market? I feel like there's a lot of people that's missing out on this great resource.
Absolutely. We definitely want to try to get that statewide, but at this time, we can't guarantee, like I said, there's a lot of work on the local end to get the farmers markets up and running and to help the farmers go through the contracting process. And then sometimes we actually get somebody on, but then they don't have a lot of produce. And so we are able to issue the coupons, but the participants aren't able to redeem them because they're just either running out or they don't have as much. So it takes a good maybe a year or two for them to get up and running, but we are encouraging, our locals to try to work with the farmers and get involved with the market masters so we can bring some more programs on board. But I agree, I would love to see it statewide.
All right, any other questions or comments? Brenda, do you want to go ahead with the agenda?
Okay, at this time, if there are no additional questions or comments, we would like to go ahead and announce the recipient of the gift card.
Okay, I have Carrie Block, and I'm gonna verify. Are you a caregiver? I'm gonna.
No. Oh, this is Carrie. Nope. I actually work for DCY, so I should not be.
Okay.
So
Okay.
please
Well,
thank you.
Thank you. Let me look down my list here, and Jerry Wamito, are you a caregiver?
I'm from
That's
Eastern Ohio.
I'm sorry.
I'm not a caregiver. I just work with the kinship program at our agency.
Okay. All right. Well, thank you for joining. Let me see. We have. Okay. I'm trying. I know some of the people on here that aren't. Oh, Dr. Ware, I know you're a caregiver. You're still on.
Yes, I am.
Okay, well, congratulations.
Thank you.
You're welcome. So Dr. Sonia Ware, who is a caregiver out of Dayton. She's also a professor at, sorry, Dr. Ware, it escapes me. Is it university? Go ahead.
Wilberforce University.
Wilberforce. She's a professor at Wilberforce University, and she's also a caregiver for her mother. So she's one of these individuals who are sort of in a sandwich situation between two caregiving responsibilities and also working. So very unique, but we've known her for a while. She's been involved with OGKC for several years, and we appreciate her support and what she's doing for her family. So we'll get you that out, Dr. Ware.
Thank you so much.
Okay, Brenda, I'm done.
Okay, congratulations, Dr. Ware. At this time, if there are no additional questions or comments or concerns, we're going to go ahead and close the meeting now. We encourage everyone to make sure that they sign up for the April 21st meeting, which is going to be a presentation on early intervention programs for youngsters. We'd like to thank Bree Haviland for her presentation today. We hope that you will find the information she presented to be very useful. It's a very good resource for those who have much younger children who meet the qualifications. It's an opportunity to start out healthy. So with that, I'll close and say thank you to everyone. Have a blessed day, and we look forward to seeing you next month.